Gastroparesis is a condition that affects the stomach. It means paralysis of the stomach. In simple terms, the stomach slows down and doesn't empty food at a normal rate. This happens because the nerves and muscles that control stomach emptying are not working properly. Gastroparesis is a relatively common condition affecting millions of people. There are several reasons why someone might develop gastroparesis. Sometimes doctors can't find a specific cause. This is called idiopathic gastroparesis. Other times, it's linked to diabetes, especially if blood sugar levels are not well controlled. Surgeries involving the stomach can also lead to gastroparesis. Certain medications like strong painkillers can slow down stomach emptying as a side effect. The most common symptom of gastroparesis is nausea, that feeling of needing to vomit. Vomiting might also occur. People with this condition often feel full quickly after eating, a symptom called early satiety. This can make it hard to eat enough and lead to weight loss. Abdominal pain and bloating are also frequent complaints. Figuring out if someone has gastroparesis involves several steps. First, the doctor will ask about symptoms and medical history. They'll want to know about any history of diabetes, surgeries, or medications taken. Next, tests are needed to rule out other conditions and confirm the diagnosis. An upper endoscopy might be done to look inside the stomach and make sure there's no blockage. A barium X-ray can show how food moves through the digestive tract. The most accurate test for gastroparesis is called a gastric emptying study. This involves eating a small meal that contains a harmless radioactive tracer. The tracer allows doctors to track how quickly the food leaves the stomach. Treating gastroparesis often requires a team approach, involving doctors, dietitians, and sometimes even psychologists. The goal is to relieve symptoms, improve nutrition, and enhance quality of life. Dietary changes are crucial. Eating smaller, more frequent meals is often recommended. It's also helpful to choose low-fat and low-fiber foods, as these are easier to digest. In severe cases, liquid meals might be necessary. Medications can help manage symptoms. Antiemetics can reduce nausea and vomiting. Prokinetics help speed up stomach emptying. Sometimes antidepressants are used to address nerve-related pain in the gut. In some situations, more invasive procedures might be considered. This could include injecting Botox into the muscle that controls stomach emptying, or implanting a device that sends electrical impulses to stimulate stomach contractions. Living with gastroparesis can be challenging, but with proper management, individuals can experience significant improvement in their symptoms and overall well-being.